So I'm going to show how to properly take a dog out of a run. What I first do is prepare my slip lead. So I put my hand through the loop. So if she gets past me, I have something to hold on to. And I make the loop big enough to go over her head. I stand in front of the door so that when I open it, I could block her from coming out and running past me. Wait. I open the door slowly, slide the slip lead over the head, tighten it, and then walk the dog out with me. Good girl. Thank you. Next, I'm going to show how to take a dog out of a lower cage. You prep quickly, just like you would as you're taking the dog out of the run. Hand through the loop, loop it so it can go over the head. I stand in front of the side that you open the door so that she can't run and dart past you. Wait. I move my body in front so there's no way they can get through. And I keep a hand on the cage door just in case they knock it open and they think they can get past. Slip the loop over the neck, step out of the way, and let them walk in a controlled manner out. Okay, next I'm going to show how to properly hold for blood draws. The first I'm going to show is the jugular blood draw. And so usually I have the dog sit between my knees so I can stabilize them. Lift up their head and lock my fingers under the jaw. And then that way the person drawing the blood can have a good visualization on the neck, and then that way they can also hold off the vein and my hands are out of the way. If there's any leashes or collars hanging around their neck, I pull that out of my way as well. And you just hold them up like that. For a cephalic, stop trying to lay down, sit. For a cephalic blood draw, stick your hand behind the elbow and lock the elbow out, and then I wrap my finger around the top of the leg and pull the vein tight so that they have it held off properly. Stop fighting me, sweetie. And then they can pull from there. And then the person drawing the blood will hold on to the foot and control the foot from that area. For the lateral saphenous, we usually have the dog lay down. Lay down. Lay down. Good girl. Put them on their side laterally. And then the person holding off will hold the leg like this so they can't move the knee around too much. And the person drawing blood will hold the foot. And then you'll see the vein pop up right there. And that's all. Thank you. So we are going to place a muzzle on Ocean. Or as we like to call the muzzle, the honesty mask. Girl. Hello, this is Pixie here, and I'm going to be doing an exam for her pre-anesthetic exam for a dental. The first thing I'm going to do is take her temperature, and I'm also getting her weight here. She's about 53 pounds. I know, your least favorite part. Nobody likes it. Good girl. Yay. While I'm taking her temperature, I'm going to just take her femoral pulse. Okay. 99.3, that's a normal temperature. And by taking the femoral pulse, you count the amounts of beats per 15 seconds and times it by 4 to get the full minute. So she get about 104 beats. Stay. Come towards me. You can sit. Sit. Stay. You're not facing the camera, young one. Next, I'm going to listen to her heart and lungs. She has a nice, strong, slow heartbeat. She's about 104 beats per minute, and her breathing rate is nice and slow, so it's about 32 breaths per minute, which is also the same when you're taking a heartbeat, doing the count for 15 seconds and timing by 4 for the full minute. Next, I'm going to look in her ears, make sure there's no wax or yeast, no foreign bodies. And her ears are very clean. Next, I'm going to look in her mouth and look at her gums and do her CRT, which is capillary refill time. And she's got a little bit of a slow, about 1.5. I'll look at the back of her teeth. She's a little bit of a tartar buildup on both sides. No teeth appear to be loose, but she does have a crack on this front canine here on the left side. Very good. Yeah, thank you. Next, I'm just going to feel her body, make sure there's no lumps, bumps, no swollen glands. And as I'm feeling her, I'm noticing her hair coat is a little bit on the dry side. Another thing I'm noticing is she is slightly overweight, so she's probably about a 6 or a 7 on the 1 to 10 line. And other than that, she looks fantastic. Oh, and her ASA grade for the dental would be a 2 because it's not life-threatening and she is in decent health. And that's all.
All right, we're going to draw from the cephalic vein. Use a little alcohol to clean the area and part of the hair. Stay. All right, good boy. And there we go.
We're going to draw some blood from Rhea's jugular vein here. Just going to clean up the area with some alcohol and part her hair.
Okay.
That's okay. Poking. Good girl, Rhea. I had it. Where'd it go? Come on. I know, I'm sorry. Patience, Rhea. Matt's just getting a little bit anxious. We can go ahead and stop the video, but I've got some blood and I've got the jug.
You're okay. Stay.
Good boy.
Stay. So the minimum databases that you would need for any anesthetic procedure to make sure that the liver and kidneys are functioning normally would be a CBC, which is the complete blood count, and the chemistry profile, which would run also or give you the numbers for ALP, ALT, BUN. ALP stands for alkaline phosphate, and the normal levels for ALP are for a dog is 5 to 131. And for cat, it would be 6 to 102. ALT stands for alanine transminase. I always have a hard time with that word. The normal ranges for the dog would be about 12 to 118, and for the cat would be 10 to 100. BUN stands for blood urea nitrogen. That's just to make sure the kidneys are working normally. And the normal rates for the cat or for the dog would be 6 to 31, and cat 14 to 36. And some additional databases that should be checked would be PCV, which is packed cell volume, and TP, total protein. And the PCV ranges for a dog would be anywhere from 29 to 55%, which is normal. And for a cat would be about 25 to 41. The total protein ranges for a dog would be about 5.2 to 7.8, and for the cat 5.2 to 8.8. Some additional profiles that you might need would be clotting times. So one of them would be PTT, which is partial thromboblastin time, and that time should equal less than 20 seconds for clotting. And that's it. Thank you. Some additions to the minimum database may require ECG, laboratory work, or radiographs. For instance, ECG, if we believe a pet has an arrhythmia, see how bad the arrhythmia possibly is and whether or not they are able to go into a surgical anesthetic procedure. And radiographs would be useful in case of a broken limb that needs to be repaired, or possibly a GDB or an abdominal obstruction. Okay, so for Pixie's pre-anesthetic and induction protocol, it would include hydromorphone and acepromazine combo. The hydromorphone would be administered at 0.1 milligrams per kilogram, which would be equal to 2.37 milligrams, or 1.19 milliliters. And acepromazine would be 0.01 milligrams per kilogram, which would be 0.24 milligrams, or 0.02 milliliters, and that would go IM. And the propofol, which would be administered IV, would be at 1 to 5 milligrams per kilogram. So it would be 24 to 120 milligrams, or 2.4 to 12 milliliters, and that would be given to effect. And then her post-op protocol would be possibly meds and possibly some antibiotics. It just depends on the doctor's orders and whether or not we have to pull teeth. Okay, the next thing I'm going to do is I'm going to do a mock drug log, a controlled substance log. We have 3 binders, but since there's nothing scripted out recently, I'm just going to do a mock log. So we have the dispense controlled substance log and the dispensing log for controlled drugs. These both go into the pharmacy. And then we have the class 2 controlled drug log for anything that we do in-house. So the first thing we do when we get a patient that needs drugs is go to the tab. We have the tabs down at the bottom that we're going to use, and I'm just going to write in something for tramadol. So what the first thing we do is we put in the date, the pet's name, the client's last name, what species the animal is, and the bottle number or code. This one happens to be C. The prescriber or the authorized signature. Initial amount in the bottle, amount used, and the balance on hand after the amount used. And if anything was wasted, like if there was any broken pills or anything fell on the floor or something that we couldn't give out. So what I'm just going to fill in the next line. And I'm just going to make up somebody's name. So today's date is 11/4/15. We're going to say the pet's name is Gypsy. Last name Smith. We're going to say it's a canine. I'm going to write that it's bottle C, so it's coming out of the same bottle. And my initials. I'm going to say, actually, the balance on hand on that last one was actually wrong. I was writing down somebody else's past one on this sheet. So the balance on hand would be 88. We'll say that I'm giving out 4 pills. And that leaves us with 84. 0 wastage. So then I would write in the initial amount for the next person who's coming on, the 84. So that all they have to do is write in the amount used, the animal it's going to, and all of that. So there's that. You can see where I just wrote, whoops, where I just wrote everything in. And then what we would do for the dispense log is when we print out the sticker that goes on the bottle for go home, we print out a second sticker for anything that's a controlled substance, and we write down the client's date of birth so that we know their legal age and we have record that it's in here. So here we have, say, Quinn, Frankie, Moose, and then I would stick the next sticker right on here. And then the controlled drug log, it's basically the same thing. So it's the date, pet name, name and address of the owner, and the client ID. We don't typically put the client ID in there because we can look it up by last name. The species, authorized signature, initial amount used, balance on hand, and any wastage. So there you go.